Hi, this is Junaid, neurocare, stroke and epilepsy specialist, and I was recently invited at APPNA, which is the Association of Physicians of Pakistani Descent of North America, to present this in their CME conference. Of course, this is not a CME. This is my YouTube channel, and we'll come to that in a minute. This is a very interesting topic that I ended up creating, spending some time on, making some slides and stuff. So I wanted to make sure that we actually end up doing this on my YouTube channel, and more also. Some people are unfortunately unable to attend the event, so they asked me to actually hopefully record this on my YouTube channel so everyone can see at a later date. Artificial intelligence in medicine. Again, this is not healthcare. This is talking about medicine. There's a difference because healthcare includes back office stuff, etc. We're going to talk more about mainly the medical part of things in terms of artificial intelligence is concerned. APNA is a huge conference that happens. Most of the physicians, of course, are of Pakistani descent, both from USA and Canada. And then I think there were about 2,000 attendees this year within the conference. I think the total membership is about 10,000. Correct me if I'm wrong. If there is any APNA member watching this, just make sure you put it in the comments so that everyone understands that it is an organization that we should all be part of because they are doing some good work. I'm not going to go into all the details, but definitely they have done some relatively good work in terms of humanity, helping physicians here in United States, including upcoming residents, etc., and of course back home in Pakistan as well. This session was recorded. This session was on Friday, and it was 20-minute session. So I was not able to go into a lot more detail. So this might be a longer video, and especially there was one more request that people told me that if you can go into more detail in this particular lecture. Before I get into that, I think it's very important that I highlight this particular symposium because that symposium that happened on healthcare entrepreneurship was very important. I think this is where the future is. And as you know, I'm building my own company. I'm building it in public. And the idea behind it is that everyone can learn, you, me, etc. And you can help me, and eventually I will be able to help you as well while I'm building this process. Because it is important that we take from idea to research, and then more importantly, we take it from research to product so that anyone in humanity can actually benefit. And it's just not research confined to academic institutions and ivory towers and journals and academic articles, but rather it is in the hands of people, helping people save lives and limbs. So this was again a brief session this time. Hopefully we're going to have a bigger session next time. One of the key partners were Open Dallas. Open is another organization that actually creates and bring all the entrepreneurs all over North America, mostly of Pakistani descent. They have Open San Francisco, Open San Antonio, Open Dallas, and therefore we were very keen to have them within this symposium as well. One of the key drivers of this symposium were Dr. Danish Bhatti. Again, you might have seen him in some of my LinkedIn profile, etc. Amazing guy to follow up. He has a big heart. He helps a lot of people. Same thing, Dr. Shahid Rafiq. He is also working on creating sort of a syndicate venture fund here for Pakistani physicians so that they can actually use their talent, most importantly as advisors, and their money to help future entrepreneurs in health tech. Mainly his focus is health tech. I personally invest everywhere, but at the end of the day, he's doing some amazing work, again, creating people, bringing them together, especially physicians, to bring both, money and, influence for everyone who wants to take it. Dr. Khalid Mahmood, again, an amazing personality out of Dallas, Texas. He is the Open Dallas president, and he has, again, helped so many people, including myself personally. And then, again, these are people who are coming together now for this important mission of bringing value to both investors and founders. And lastly, Dr. Fareed Suri. I mean, he is just an amazing person. I'm a software guy, so honestly, hardware actually intimidates me. He is building another company. I'm not sure how much I'm going to be able to tell you about this. So I'm going to say that he is, again, a very massive heart that has helped many people. And he is building another fantastic company with everyone involved in this progress. So the idea is that we are taking this to the next level. Hopefully, again, this has nothing to do with APNA per se, but I just wanted to highlight that these are the people that are in attendance at the symposium. And so therefore it was so valuable to see so many people getting together, and therefore anyone who attends these can actually be able to get much more value out of their time as compared to anything. And of course, Apna is not just about work and fun. It is literally one of the best places to have some party time. That's my wife, Aisha, and we were actually on two different concerts. One was Ali Sethi and Sajad Ali, and the first one was Ali Zafar. So we had a blast as far as me and my wife. We ignored our kids at that time, and had a lot of fun. And of course, afterwards, it was more fun, pleasure, and fun as well. So we were at Dr. Khalid Mahmood's house, up the Dallas president, and we had this, a lot of people, again, coming from Dallas itself, some people flying from Orlando, everything. And then we got together, both as a social networking. So I'm very glad that he did that, because we were, again, able to exchange contact information, etc., because time is always a precious thing. So again, we work hard and then we party harder. So I'm going to go back to now the presentation, artificial intelligence in medicine. So whenever you're doing CMEs, and this is not a CME, you have to disclose things. So one of the things I always say, that since I am not a Supreme Court justice, so I have to disclose things, right? I mean, it's annoying that Supreme Court justices does not have to do disclosures, but I have to. Oh, what is that? I do invest in AI companies, I accelerate AI companies, I founded an AI company, and I do clinically advise in terms of specifically for compliance. I am actually approached quite a bit by different AI companies to help. And of course, when I do all of this, my wife is really unhappy with me, because clearly I'm giving you some time. Anyways, let's get into it. Artificial intelligence, especially now, is literally the most profound thing humanity has done. It is more profound than fire and electricity. Can you believe that? This is Sanjay Pichai, the CEO of Google. It is a transformative, seismic shift, paradigm shift of how we do things. And in the artificial intelligence space, their most important priority is healthcare. It is annoying to see that we are not able to do so. Healthcare is the most important, urgent application of artificial intelligence. And that is, again, CEO of Microsoft, Satya Nadella, that says that. Um, Again, people may disagree with a lot of things, but believe it or not, with the sometimes you see a lot of people, fighting over RVUs, unfortunately. There's a lot of things to be done, and artificial intelligence need to bring better clinical outcomes, improve our moral injury, that's the term I use, not burnout, as far as clinicians are concerned, including nurses are concerned. And therefore AI is going to be significantly important to really deliver high quality care and outcomes. Not just care, we can deliver care and we have good in activity, but we need to be good in outcomes. And the first step is to measure them, right? So the where AI shines is that get massive amount of data and then make intelligence out of it. And the minute you have measuring capability, then you can increase the outcomes. And believe it or not, value-based care is going to be all dependent on artificial intelligence. Okay, what is the current state? This actually paper is a little 2017, I believe. But I'm going to still say that the current state is this. So again, we have the narrow artificial intelligence. I'm going to come to it. And then we have this. So in some areas, we are actually neck to neck. In some areas, AI is actually now better. Especially like some chest radiology images, etc. We are looking at that artificial intelligence is even better than human beings. But the problem is this, right? The biggest problem is this, as far as that is concerned, is that we are here, but the human performance generally stays, at this rate. But the computer performance is going to go like this. And that is the key thing. They improve faster, better, easier, much, 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 much faster than us. And more importantly, if an algorithm learns from China, Korea, Japan, Russia, wherever, it can actually, all the computers can learn technically. I mean, of course, there's proprietary issues and all of that. But at the end of the day, you see that all these companies get bought up, and then you create more and more companies into one big umbrella, and then that becomes a unicorn, etc. So what you're looking at is that you're looking at a massive amount of computer performance is going to continue to increase. Unfortunately, human performance has a limit in terms of increasing. It will never be at this exponential age. And how do you determine the future state of any industry? Or as a matter of fact, if you want to ask a question, if it's an industry you're going to go work into in the next 10 years, is it going to be growing or dying, supposedly? So at that point in time, you have to look at the number of research dollars that are going into it, the dollars in research and the amount of research output. And as you can see, artificial intelligence, this is just healthcare. If I take artificial intelligence like through computer science, which I have to follow, that is just exponential. It's huge. The amount of papers that are coming out of archive. This is actually the trajectory is like this, not like this even. In healthcare, it is definitely going improving as well. So you can see that the future state, that's how it works, right? You research it, then you make it into a product. That's literally what I've been talking about. And the idea is that the amount of research is going into it, the number of products are going to go up, the number of products are going to go up, number of companies are going to go up, number of companies are going to go up, more companies are get together and then form unicorns. So that's basically how we do it. One of the things that I discussed in the last lecture is that the primer on artificial intelligence is spined by the brain. I just love it. That's why as a neurologist, it's just truly mind-boggling that most neurologists are not that interested, because it reflects literally how our brain works. As a matter of fact, it was developed, the whole artificial ANN was developed to understand the brain better. So we have, dendrites, the axon, and then the exon cell bodies, and you can see that it totally reflects how a perceptron, this is just one artificial intelligence neural network. Of course, we have tons and tons of them layered up, exactly how different dendrites are connecting to other neurons. When we talk about artificial intelligence, I hate that word, to be honest with you. The best word is machine learning. And the reason that machine learning, within machine learning, the most of the fun stuff is in the deep learning part. And to be honest, in the best way format, of course, we're using a layman's term and on YouTube and everything. I think the best place you should identify is this machine learning or deep learning, and not use artificial intelligence, because artificial intelligence keep confusing from, AGI, artificial general intelligence, and, StarNet and all that crap that comes into movies. We're not doing that. What we are doing is machine learning, and within that subset, mainly we're looking at deep learning. So what is the difference? The difference is that when I was programming, in the basic programming, and still like Python that I do, it used to be x equal to y equal to z, blah, 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 take this, etc., and then, format it. The idea was that I'm giving instructions to the computer that, hey, do this. What changed, what the seismic shift, what the paradigm shift is when artificial intelligence, specifically deep learning, comes in, I don't give instructions. I give examples. Here are a million images of cat, here are a million images of dog, go learn it. And then I give another 10,000 bunch and ask the artificial intelligence network, where is this a cat or a dog? That's literally how humans learn. You are going from human coding, which is basically instructions, to data coding, which is basically examples. Huge paradigm shift. And that changes literally, believe it or not, a lot of things. And that's why people say it's just a hype. Yeah, I know. And I'm deep into it. And yes, some of it is hype. I get it. But this is a fundamental shifting technology of our time, maybe for a long time. The other question I keep getting is that what is the difference between machine learning and algorithm? Like, algorithms, if you compare them, you compare the architecture of a whole city with basically a sandcastle. So huge difference again. Statistics, or algorithms, and I'm going to come to another example. The idea behind it is that we find relationships. We want to find if this is a correlation, causation, etc. However, when we are talking about machine learning, we're talking about prediction. And therefore, you have to understand, whenever machine learning is concerned, literally it is about prediction. If I have this, like if it's a cat or dog, it gives me literally 96% sensitivity, 98% sensitivity, that the picture that I sent it to you, it is more probable to be a cat or a dog at the base level. But the whole point of doing machine learning is prediction. And then, of course, we use algorithms everywhere, right? This is an algorithm, right? All the time, right? Generalized tenderness, you do this, and then you go follow the whole algorithm right there. What is the difference between an algorithm and a machine learning? When you add automation, right? Add the data, the learning component into it. Because people confuse this all the time. Oh, I have a artificial intelligence, and I ask them, what is it? They point to an algorithm. That's a freaking algorithm. You are not doing any learning. That is the key point. You have massive amount of data that is actually learning, and then you have additional steps in human feedback form or a non-human feedback form or a constitutional AI form or a self-supervised form, whatever that form may be. You are also adding, hopefully one day, continuous learning. Continuous learning is something that we don't do in medicine. I'm going to come to that. So the minute you have automation, the minute you have prediction, and you have learning, this chart with data, of course, learning comes in, then becomes machine learning. Okay, so that's the real difference between algorithms. Now, I can go into technical details, but again, this is something about that my audience is generally physicians or laypersons that are interested, and then they can go back into other places where they can go into details. But the types of machine learning are supervised, semi-supervised, unsupervised, and reinforcement. Of course, this reinforcement learning is one of the key things that, RHLF, which was basically creating, improving, actually not creating Chat GPT and GPT-4, because they use a lot of human feedback in terms of reinforcing the model. So you create a reward-based model that basically goes in, and then of course you can add GAN if you want to. Anyways, long story short, these are different types of machine learning, and one of the key ones that are coming up is basically the self-supervised learning. And then of course we talk about transfer learning, and then this actually becomes the core of generative AI. I'm going to do a whole series on these two, like what are the types of learning, and go from there. It's going to take me a while, but stay back. If you want it sooner, make sure you put it in the comments. The key article or research that came out and that created this massive space of generative AI was Transformers. This one paper, Attention is All You Need, is probably one of the most important paper. Interestingly, this was done in 2017. It is 2023, 18, 19, 20, 21, 22, 23, 6 years down the line. Within 6 years, we are able to transform what we are thinking in terms of everything, honestly. As a matter of fact, this is the presentation that NVIDIA's CEO gave, the iPhone moment of AI. What he meant by that was basically that any text you can take, anything, actually, this is the transformer model, right? Any data, is maybe text, you can convert it into image, mid-journey. You want to take audio, you can convert it into video. There now you can just say a story and you can do that. You can take an image and you can turn it into text. So they will explain to you that's ChatGPT-4. That is a multi-modal model that you give them an image, it will explain that image to you. You can take 3D concept, turn it into, again, a video, or another 3D one if you want to, because man, you didn't like it, so let the AI do the one. Of course, video, DNA, protein, molecular, animation. Any type of data can be converted into any kind of data because it is a transformer. So all data becomes accessible, available, and changeable. And that is the true power of transformers as we go along. One of the other key concepts I wanted to let physicians know specifically was that what is the general virtual care and AI is important in terms of our ability. The big thing about virtual care is that it is the first step towards digitalization. And then when you add AI to it, then the whole is greater than the sum of its parts. And this is a book chapter that I wrote in this book, Artificial Intelligence, A Practical Guide for Healthcare. Do take a look at it and then read this chapter if you want. The conceptually, what I wanted to go from is basically digitization to digitalization to digital transformation. So you go from telemedicine to telehealth. Telemedicine is just what? A video conference of physician and pharmacist. What is telehealth comes in? Telehealth comes in when remote patient monitoring, health IO2, teletherapies, e-sitters, etc. All of these come in. And then when you have true digital health transformation, then you have AI, analytics, computing, experiences, data. How do I distinguish this? It's better to understand it from mapping technology. Digitization was taking this paper map that you used to have and turning it into a PDF. That was crap, right? I mean, who's going to do that? So we had, I think there was a small thing that just ended up changing that PDF into point-to-point direction. And I remember back in 2017, I would go to that website. I'm missing out. Somebody put it in the comments, and I just used to initial address, destination, then it will give you literally turn by turn direction, and that was it. I would print that out probably or write it down like brief stuff, and then take it with me. Of course, that is where the digital transformation comes in. Is where that is where Google Maps come in. By the way, Google Maps make $2 billion a year. That's their thing. What it enables is new digital experiences. Now, because of that, you get your DoorDash, you get your masseuse at home, you get literally all of those things. You get everything in from point to point direction, and it literally enables so many more digital experiences because of just having the maps truly digitally transformed. So that's where it is. Same thing is going to happen with medicine when you have telehealth going into telemedicine. So we are really jumping up the gun, and then we're going to digital health. And not to mention, if you're going to have all this data, audio, video, text, and you can convert it into any more of those, then you're going to have true amazing experiences that you never had it before. One more thing that people think that, well, artificial intelligence is like in the movies. Yes, I get it. It's bullshit, and half of it is a freaking lie, which really pisses me off because the true potential is not shown to people what it can be done. The way AI is going to develop as service. I know those who are inclined towards software as a service. That's what we use, SaaS, right? AI is going to be as a service. It's going to be everyone is going to develop. So I'm developing CT hemorrhage model. He's developing GI polyp module. He's developing dermatology module, whatever. These small modules of clinical services are going to come up, right? Diagnostic, radiology, pathology, etc. Then there are modules that are going to be specifically designed for engagement and education for both patient and provider. That's another way. Then there's going to be multi-omics, where you're going to be genomics, metabolics, and microbiomics. Then there's going to be another one, which is going to be paraclinical services, where people are going to optimize for prior authorizations, payments authority, quality improvement, discharge, etc. So these are all going to be different AI modules. As I said, these are going to be all maybe even different companies that are going to come and bring together an AI experience as we move along the value chain of artificial intelligence. Again, AI in healthcare will always be slower than what we see in image and everything. So as an example, I just wanted to touch on 3 areas. There are much more areas, and I tell you that I cannot cover them, and I don't know half of them. Okay, I don't know about DNA, protein, molecule, etc. I don't know all of that, right? So I'm not going to talk about it. I'm actually into more of a direct clinical analysis, etc. So one of the biggest things is computer vision, then natural language processing, and AI analytics. I'm going to highlight 3 of them, and then we'll go from there. Deep learning algorithm for automated detection and classification of intracranial hemorrhages and CAT scans. Again, if you look at the sensitivity area under the curve, 9.88, sensitivity is around 95% or so. So we are seeing that a significant improvement, and you can use this specifically in clinical application. FDA has approved a few of them. I'm actually looking into it potentially. I created the same module myself, and the idea behind was that I am hopefully going to be doing this into low and middle income countries completely free. Of course, starting with Pakistan just because I have more connections there, but this whole application will be free for low and middle income countries so that we can revolutionize stroke care. By the grace of the force, I'm doing very well, and I wanted to make sure that things that I've learned, I can give back to the community. So that's why I ended up developing this massive thing. We're going to have some live sites going on. Make sure you follow on LinkedIn and Twitter, and we'll be announcing those things pretty soon. Now we come to natural language, computer vision, pathology, radiology, or dermatology. All of that comes into the computer image analysis. Then you have natural language processing, all about large language models. And this is amazing. Healthcare scaling language model, all-purpose prediction engines. I did a whole video just on this paper. So make sure you go back and look at that, in which we discussed like these clinical tasks and operational tasks and how artificial intelligence was able to predict better than physicians. Again, who gives a damn about this comparison? I hate this comparison that it's physician versus this. It is creating a value chain, period. Doesn't matter if it's better than me. As long as it's getting the work done, we're doing faster, decreases my moral injury / burnout, improves, saves cost, improves patient outcomes. To hell with it. It doesn't matter if it's better than me or not. Anyways, the second thing, of course, is the last thing that I work on is mainly analytics, in which we can see that clinical electrocardiograms are actually truly at par with clinicians in reading EEGs, especially when the EEG length is longer, because then again, everything depends on the data, and therefore, when the length is longer is good. And again, as we talked about this, transformer models, where you are basically able to change everything from everything, we're going to see this as the next big thing in healthcare as well. What we're going to see is that future is all multimodal. We're going to have omics, microbiomics, EHRs, wearable centers, digital twins, hospital at home. We're going to have all of these coming together to form multimodal artificial intelligence, and those companies who can do more than one, language plus computer vision, or language plus AI analytics, or video in ultrasound, or then this, or video analysis, because you can have a facial group automatically from a stroke. Any companies who are doing this multimodal thing is going to take a big chunk of the slice. Again, there's a big pie. Everyone will share the pie. Don't worry. There's no big competition. I hate thinking that one company can do it all. So we're going to do it all together. The idea is that multimodality is the future in terms of audio, image input, and we're going to see this in physicians as well. One of the big questions that keep coming to me is, what is AI and what is it not? Artificial intelligence is not here to replace you. I mean, maybe some few people who are stubborn enough not to take technology and start using it, but most of the people will use it, and honestly it is being used. I mean, you may not know, but all of your reports and papers and the way you're getting reimbursed right now, insurance companies are using artificial intelligence heavily. So good luck with it. It's just, you are already being evaluated on that. AIs are evaluating it. Long story short, the whole idea behind it is to augment you, to assist you, to improve your application in terms of education, evidence-based medicine, etc. And it should be ambient, right? I mean, it should not show, like example, like it does not need to be in your face, and that is something that I really do care about. And then finally, a semi-autonomous way to improve your productivity. Again, not to replace physicians. And then this is one of the quotes that I always say, that will AI ever replace physicians? The answer is no. But physicians who use AI will replace physicians who do not. Now, the question is, will ever? Again, that is a question. I'm going to be very honest with you. I can never see beyond 2 years or so. However, it is the important thing to understand from a technical perspective. I always say, from a technical perspective, can you replace a doctor completely with an AI? Yes, in about 5 years. Yeah, completely. But that's not the problem. Medicine is not about technical only. It is a social thing. We actually interact with human beings. And from a social acceptance point of view, I doubt it. It is going to be, I don't know. I'm going to be, and my 80-year-old does use Midjourney to create, applications. I don't know, in future when she goes to the doctor, maybe she'll be okay with using another AI model for it. But this generation, even including mine, is not going to be okay with it. 20 years from now, who knows? But from a technical perspective, yes, in 5 years, you can have an AI replaced model, AI that can replace physician completely. Diagnostics, therapeutics, clinical decision making, everything. That's what we're looking at. But that's not it, right? We are social human beings, and we are social. And therefore, there's a social component that's going to take a while, maybe a generation. So that's where it's important. And that's one of the things, like if you want to connect with me, scan that QR code on LinkedIn, make sure that you do connect with me, because I love to hear from you. Better to put it on the comments. It helps me. But if not, feel free to send me a message over LinkedIn. This is the application that we developed. We are in beta testing right now. So please scan this QR code over here and then install this application. We are releasing updates literally daily right now. It's available on Google App Store and Google Play Store. We're going to release desktop app soon, and then web app, and we're constantly improving this. You're going to hear more about it. I'll show a demo after this, because this is something that is really dear to me, to improve how to get to clinical evidence faster, but more importantly, make biomedical research, especially, it's just annoying explosion of things, so that you can be faster, better in your research. Thank you.